Hi, my name is Dr. Janna Bentley. I'm the Medical Director of Lakeshore Vein and Aesthetics Clinic. You are about to watch a video about CoolSculpting. During the video, if you have any questions, feel free to write them down. Maybe grab a piece of paper and a pen, and you can pause the video, you can rewind it, you can fast forward it, and just write down your questions. You can email us, call us, or even drop in with your questions and we will give you clarity. And I'd like to introduce our lead CoolSculpting technician. Her name is Lisa. She's lovely and she is highly trained in this procedure.
CoolSculpting is a method of reducing fat that is non-invasive. It's an easy treatment for patient because all we do is freeze the particular area that you're concerned with, and then you can go about your day in a normal way. You do have to be a good candidate, however, and that is very important that you actually meet myself or another CoolSculpt tech to have a proper assessment, because we can only treat subcutaneous fat versus visceral fat. A good candidate would be someone who has subcutaneous tissue to treat. They also have to have very realistic expectations. So CoolSculpting is not meant to lose a person's weight. It's not going to affect your weight. It is simply to decrease those smaller bulges that you have not been able to get rid of through diet and exercise. So it's ideal for that person who has come to their sort of plateau and they need a little help to get past it. Thus the name CoolSculpting. It is actually to give you shape. Even though the first part of the consult is just conversation and questions and answers, the latter part of the consult is where you do have to reveal the area that you're concerned about. And I do physically touch, poke, and prod at the person whom I'm meeting with. When you come in, our first part, we roughly take about 30 minutes probably to do your weight, your pictures, marking, and just reiterating what our treatment plan was. I always have a robe on the bed. There's a pair of socks, and there's also like a pair of, like, whether it's a man, there's shorts. If it's a female, then there's underwear and like a bra top, and you change into that. Then I take your weight, we do pictures, I do marking based on what your treatment plan was, and then we get you cozy in the bed and we start applying the CoolSculpting applicator to your body. When we put on the applicator, it is by means of suction, which that applicator takes in your tissue. So then you have that suction sort of sensation. It can feel a bit like it's tugging, and that lasts somewhere between 8 to 10 minutes, because by that time you are actually indeed frozen and people just pretty much sit back and relax. You are reclined in the bed, you have pillows all around you, you are nestled in very comfortably, blanket over top. We'll offer you anything you would like to drink, of course. If you are here for a very long duration, then we would bring in lunch for you. But yeah, you're very comfortable. People often can work on their laptops and do some work. They'll read their books, or the general population sits with their phone and just texts and does whatever they need to do. So most people really find it very relaxing. And I actually do have a number of clients that take that time to actually nod off. We just turn off the lights and they go to sleep. There is really no standard because every person is very individual. If it's, say, 4 cycles, then you can expect to be here roughly about 3 to 3.5 hours. We always have to retreat as well. So it is not just a one-stop process, which is very important for people to understand as well. Once we start treatment, it's important that we have enough time to keep you comfortable, allow you to get up and take breaks, go to the washroom, whatever you need. So I always allow ample time, but it really does go by the type of applicator we're using as well as how many applications we're doing. Some people are more sensitive, but the actual sensation and the sensitivity is to the cold itself, and also when your tissue comes back to room temperature. You can go through that period of time where it almost feels like when you've come off the mountain, your fingertips are numb, and as they come back to get like life and blood flow back to them, you get that prickly heat sensation. That's the worst of it. In actual fact, the point where it's probably most uncomfortable is when you take off the applicator, and I do give you that 2-minute manual massage. It's hands-on, and the reason for me doing that is because it benefits that procedure by 68%, because once those fat cells are in a nice little tight cluster, they're crystallized, and when I massage, it breaks them apart and allows your lymphatic system to naturally address them as dead cells and then flush them through. So it's really important, and ironically, that 2 minutes is probably the most uncomfortable of the entire procedure. After the procedure, your tissue that has been treated is red. It can almost look a little bit blanched. It could have like some little whitey areas. Within 15 to 20 minutes, your skin actually comes back to normal, room temperature. The redness goes away. For some people, they can get a bit of pigmentation topically to their skin, but that also tends to fade over time. Some people experience a bit of swelling after doing CoolSculpting, and that's not everyone, but some. I myself actually did. You can anticipate to be tender. So in other words, when you touch your tissue, it is going to feel tender. That diminishes over the next few days. Some people feel it for about a week. And then it just gets less and less and less. There is no permanent damage to the nerve or the tissue at all. So it's just a matter of when your tissue comes back to its normal processes and all your nerve endings are back to life, your tissue becomes just as it was pre-CoolSculpting. The treatment itself can take up to 3 months, even 4 months, to fully have your absolute best results at that point. But I really do find that most people start to see it around 8 weeks. That seems to be the turning point. And visually, if we take pictures 8 weeks after, we can start to see some results. The best thing you can do is go about your regular life, keep your diet as far as drinking water, eating healthy, getting your exercise. However, I will add that you will feel that sort of mass where it has been frozen. You do sense it, so probably going for a great big huge run is going to feel a little bit unusual, but you can certainly go and do everything. There's nothing to prevent you from doing your regular activities. You can't really change the efficacy of CoolSculpting. It is a treatment that is proven and it is doing its own job. So you just have to have faith that it will do what it should do.
Thank you for watching this video about CoolSculpting. I hope that your questions have been answered. If you still have any lingering questions, feel free to drop by, email us, or call with those questions, and our team will be happy to assist you. And we are looking forward to seeing you.